Welcome back to the third hour of our program, and Wendell Potter is with us. Wendell is the health insurance industry whistleblower, former vice president with one of the largest of the health insurance companies, the author of Deadly Spin, the book about the health insurance company and their deadly spin, I guess. And his website, Wendell Potter, Potter, WendellPotter.com. Wendell, welcome back to the program.
Well, thanks for having me back. Appreciate it.
It is great having you on. What I wanted to do with this hour is ask you questions and open the phone lines up, 866-987-THOM, to any of our callers who may have questions about Obamacare, because it seems like there is just all this incredible confusion out there, much of it being sown and seeded by people who have political rather than health agendas. And so are you up for that?
I sure am.
Okay.
Bring it on.
So first of all, I've got a couple of questions here from an old friend of mine. We used to call him Java Man back in the day. His name is Tom. And he wrote down three of them that I'll just throw at you. And he said, if you have an income, he lives in Michigan, okay? And Michigan, of course, has a crackpot governor, and they're not taking Medicaid money. So what if you have income at 1.5 times the poverty level or less and live in a state that has rejected Medicaid? You would have gotten free Medicaid, but now do you just get nothing since you would qualify for Medicaid? However, your state does not offer it. Or can you apply the income formulas that those who make more than 1.5 times the poverty level will use, buy insurance from the exchanges, and get a tax rate rebate that would virtually cover all the costs, like maybe a monthly cost of $10 or $20 after the rebate?
You know, what you can do is, in those states that are not expanding Medicaid, when you go to the exchange or when you're looking to buy insurance, if you need to buy it on your own through the exchange, project what your income likely will be, and who knows what your income will be since you're making a projection. But it's entirely legal and possible to suggest that your income will be such that you would be able to qualify for a tax credit. And that's what I think is going to be recommended for those in those states who are the states that are not expanding Medicaid, for Medicaid eligible people or people who will be eligible in other states. So just pay attention to that part of the questionnaire when you sign up or when you go to the online marketplace in your state, and that way you can get insurance and be able to qualify for a subsidy.
Right, and a tax credit is unlike a tax deduction. A tax deduction is they take less of your money in taxes or give you a refund on the money that you paid, whereas a tax credit is, even if you don't pay any income taxes, if your income is so low or you have enough deductions or whatever, a tax credit is where the government writes you a check. And,
that's correct.
And so how do, and this is, basically, I guess the third of Tom's questions. He says, I've not heard anywhere any information on how the rebates will work. They will be very important for people under the 40K income bracket. And I'm assuming he means because of cash flow. Also, will they, I assume the IRS, use AGI or gross income in the calculation? My guess is AGI, but who even decides these things? So how does this work? Do you get, if you're paying for your insurance month by month and you're buying it on the exchange because your state has not expanded Medicare, you've got a Republican governor who won't take the federal money, do you have to buy it all year long and then at the end of the year the government writes you a check, or do they give you a check every month, or how does that work?
I think we're going to see some of those details as we get really close to the online marketplace. We're still about a month and a half away, and some details like that are still being worked out. I don't think that it'll be a requirement, though, that people will have to pay for money they don't, pay for insurance with income they simply don't have. So I think there'll be an accommodation, and it's going to be important for those who are serving as navigators, and every state will have navigators to be available to help people with those kinds of questions. And also, a lot of those questions can be answered online. I would make a point, too, of going to a website that's sort of a prototype or a precursor of what the online marketplaces will be for answers to a lot of questions. It's healthcare.gov. It's a very good resource operated by the Department of Health and Human Services that can help provide information that is known right now. Some rules are in the final stages of being developed, and including the IRS rules that pertain to the tax credits and subsidies.
Right. Because it seems like, if you're buying, if you have a very low income or you're on Social Security or whatever, but let's say you just have a very low income, not to complicate things, and your health insurance for you and your family would be, say, $500 a month, but you qualify for $490 a month in tax credits. It would be, $500 a month is a lot of money. And for somebody who has a very low income, just being able to write that check to the health insurance company, even though they know that at the end of the quarter or at the end of the year, they're going to get a check from the government to reimburse them, is going to be beyond the cash flow capability of most low-income people.
Oh, it certainly will. And I think what the reality will be, that it will be handled on kind of a cashless basis. In other words, the individual or the family probably will not be in the position of having to make those kinds of payments. It's my understanding that the money will go actually to the insurance company from the federal government. I think that would.
So your tax credit will be written right to the insurance company as basically as a premium payment.
That was exactly the understanding that I had, and I think that is how it will be handled. Because you're exactly right. Many people simply don't have funds, and nor do they have many people the checking accounts to be able to do that. So much of what has to be worked out in these final days is just those kinds of issues. But it's my understanding that the money would go directly to the insurance company of the insurance company that provides the plan that the person or family chooses.
Okay. And the last of Tom's questions here, he said, I believe there's a lawsuit pending, not sure, that says the IRS cannot be involved in this. Not exactly sure what the issue is, but I believe it has to do with the IRS collecting the penalties for those who do not get insurance. But the IRS will be doing more than collect penalties. They'll manage the rebates for those who are eligible. It would seem that if the IRS cannot be involved, and if that means they cannot do either function, then it would appear Obamacare is totally gutted. Is this an issue down the road?
No, it's not an issue. I don't think so. It's I think that there's been so much litigation and there's been threatened. A lot of lawsuits have been filed. I don't think that's anything anyone should be concerned about. The IRS certainly has the authority to do exactly that. So I don't think it's going to be an issue.
Right. Now, the level of income at which rebates or subsidies starts kicking in is what?
Well, for subsidies, it is beyond 100. Well, let's see. I think it is beyond 138% of the federal poverty line. The Medicaid expansion will be including people who have incomes up to 138% of federal poverty.
And how much is that?
Federal poverty line. Are you catching me off guard? I think it's. I'll have to get back with you on that. I can't off the top of my head know exactly what the current FPL is. But it's it's an amount that will bring in a lot of people who are currently uninsured in most states. Now the subsidies will be available for people who are in that incomes between 138% and 400% of the poverty level.
Up to 400%. Wendell, we got to take just a very quick break here. We'll be back in just a few seconds. Wendell Potter is with us. WendellPotter.com, his website.